have fibroids. I bet you have a million questions. Should I remove them? Are they life-threatening? Do I need a hysterectomy? Will they affect my fertility? Well, guess what? You are not alone. Half of all women will get them, and most, they don't even know it. Many are left wondering, what should I do about my fibroids?
Fibroids. They strike up to 50% of all women, and African-American women have a risk that's 3 times higher. Fibroids are non-cancerous tumors that grow in the wall of the uterus and can range from microscopic to melon-sized. And unless symptoms occur, many women don't even know they have them. While the cause of fibroids is unknown, what is known is that when symptoms do occur, they can be nothing short of brutal. Bleeding so heavy it causes anemia, pelvic pain that can cause loss of libido, and increased urination are all too common. So how should you deal with your fibroids? For many years, women were told they needed a complete hysterectomy. But today, there are so many more options, from diet to hormone therapies to lesser procedures. Today, find out what is right for you.
I brought in gynecologist Dr. Jessica Shepard to help us figure out what women can do about their fibroids. Also joining me are Erica, Donna, and Crystal, who are contemplating what to do about their fibroids. Welcome all to the show. Dr. Shepard, how does a woman know she has fibroids?
So when we discuss fibroids, we talk about symptomatic fibroids and asymptomatic fibroids. Symptomatic fibroids are your women who come to the office and they have heavy bleeding. They have abdominal girth growth, so they have abdominal bloating, even urinary incontinence because that fibroid might be pushing on their bladder. But for asymptomatic fibroids, most women have fibroids and don't know about it. So they just have no symptoms whatsoever. These may be found when you have an imaging study that may be done for something else, as an ultrasound or a CT scan, and they just happen to pick up that this woman has fibroids.
Or the symptoms are subtle enough we miss them.
Yep,
It's
absolutely.
So, Donna, Erica, Crystal, any of these symptoms?
Yes,
Yeah,
yes. I have
absolutely.
symptoms for the past 5 years. I've been dealing with this. I have heavy bleeding during my periods. I have heavy bleeding in between my periods, so I feel like I always have a period. My belly sticks out constantly. I feel like, and I look like I'm 14 weeks pregnant. I have to go for ultrasounds twice a year. I have to go for a biopsy once a year. And I'm tired. I'm anemic, you know, a lot. And I take iron pills, but I'm just tired, and I'm just tired of it.
Erica, Crystal, you have symptoms as well?
Absolutely. Yes, I have symptoms as well. And actually, I thought I was asymptomatic until I went to the doctor because I was having a problem holding my urine. And I found out that I actually have fibroids. So now I'm at a point, I do want to know my options and what can be done.
So before we go any further talking about these specific issues, let's talk about how fibroids form and why they can cause some of these painful symptoms. So Jessica mentioned that there's 2 sides that we have to focus on when we talk about a uterus. This is what a uterus looks like.
This is such a great model.
Well, it's a real one, which makes it accurate. Now, sometimes these fibroids get pretty large.
Yes, they
So I
do.
brought you something that you will probably remember after today. That is a fibroid.
I would say that's the monster of fibroids, yes.
Can you all see this? And just to give you an idea how heavy it is. So if I wanted to give you examples from your kitchen, these are different kinds of fibroids.
It's always a good way to do that, right?
They can be very small, the size of a grape. It can still cause problems. They cause fertility issues, bleeding, etc. They can get larger, the size of an orange, not uncommon. And sometimes, crazily, I've actually seen this. You've probably seen many more than me.
You can compare them. I mean, the size of this to that is pretty relative. Most women will come in with the size of either this, or multiple amounts of grapes and oranges, if you want to say that. But I have seen women with watermelon-sized fibroids.
So I've asked our 3 women to help us with a little demonstration.
Yes.
I want you to all understand exactly what goes on when these fibroids get larger in your body. So I have little name tags. Who wants to be the uterus? All right, Crystal, you get to be the uterus.
I'd rather be the uterus.
Erica, you get to be the GI tract, and you get to be the bladder.
Okay.
Now, just to be careful, these may come in handy. Your earplugs. You'll see why in a second. You should always be nervous if someone gives you earplugs. Never a good sign. So I built you a little, and inside that body, you see that little balloon? That represents the beginning of a fibroid. The beginning of a fibroid. So I'm going to ask you all to step in here, but you have to go to the anatomically correct place. So uterus, going over there, Crystal. Okay. Erica, you be the GI tract. You stay on my side in the back here. You can face us, Crystal, face forward. And the bladder has to be in the very front and low down. So go ahead and crouch down if you don't mind. Way down, way down, way down, because the bladder's beneath There we are. I'm going to seal you guys in there. So what ends up happening pretty quickly is as that fibroid begins to grow, let's grow that fibroid a little bit. You got to crouch down a little more, Donna. There we are. Yeah, it gets larger and larger and larger. It begins to squeeze down on the bladder, causing incontinence and urinary tract infections.
That bladder is getting way down there.
It's getting down. It also pushes on the uterus. Go back, Crystal. And that causes some of that heavy bleeding. It can also push on the GI tract. That causes abdominal pain and addition. And you can stop that fibroid growing because guess what happens?
We add more.
Throw that in there. We get more fibroids because you saw in that big one, we had lots of fibroids growing. And when they get in there, they can really hassle you. All right. And then sometimes they get really big. Is you getting uncomfortable in there?
Yes.
But you see, these fibroids actually will push out on this wall, and they will distend your abdomen. Belly gets pushed out with these fibroids pushing against it like that. You'll end up with a scenario where you're really uncomfortable, and that discomfort you face calls for action. The question is, what are you going to do about it if this is what your body looks like on the inside? Ladies, thank you very, very much. Come on out.
Good job.
So go have a seat over there. We're going to talk a little bit about options. So, Dr. Shepard, let's walk everyone through the options about getting their fibroids removed and what we can do to avoid that process in its entirety.
And I think that's the important thing is now women have options.
So let's go through. First, you know, obviously, for years, when people thought about hysterectomies, it was synonymous with having a fibroid. And I do think this is the overperformed operation of our decade. So I think that's changing. Is that your impression as well?
Absolutely. You know, a woman does not have to have a hysterectomy simply because she has fibroids. Now, that is the most common reason why we do perform hysterectomies, but I think the beauty of science and technology is that we have so many other options that we can offer to women, and it really depends where they are with their journey with their fibroids.
So let me ask Crystal.
Yes.
Your thoughts on hysterectomies? You offered that as a solution, and
No, painkillers.
you were given painkillers, Crystal.
Either offered painkillers, especially when I was pregnant, yes. I was just like an option, so it would not be a problem in the future.
Eric, how about you?
Actually, my doctor told me I could never have kids with the type of fibroids I have.
My goodness.
That's unfortunate.
How long ago did your doctor tell you that?
Actually, it was a phone conversation last week.
Oh. Well, Eric, I want you down as well. You know, I hear this all the time.
Yes, my doctor and I discuss it frequently, but I'd rather be natural. I want to wait for maybe menopause and have them shrink naturally.
Let's go through all these scenarios then. Yeah. I'm hearing painkillers, I'm hearing infertility, and I'm sorry about the conversation that should have taken place in person, but it's painful no matter how it's heard. And then the issue of whether you can do it without any major intervention. So first, walk us through the first option of whether or not a dietary approach actually does make sense.
So for Crystal, you know, she's been given, you know, pain medications, which may or may not be helping, but she does have options with dietary modification. There have been studies that have been done on dietary modification, but she can also have things such as a uterine artery embolization, which just occludes the blood supply specifically to the fibroids. She can have a procedure where we remove the fibroid from inside of the uterus with a MyoSure, and that is a very minimally invasive surgery. She'd be in and out the same day. So the myomectomy simply is taking the fibroid from the uterus and leaving the uterus intact. And so the beauty of this surgery is that you have very small incisions, which can range anywhere from 0.5 centimeter to 1.5 centimeters. Your recovery time is reduced. And these patients really are satisfied with their procedure and the outcome. And again, that's something that can be discussed with one of your physicians.
So when we talk about natural, the most natural thing is to eat naturally.
And so that's somewhere women can start with. So when we talk about foods, we really want to hone in on avoiding high index glycemic foods and high fatty foods and focus more on our foods that have high vitamin D levels. So we're going to talk about our citrus fruits, our green leafy vegetables. We have our vitamin D milk, anything that's really going to increase that vitamin D level.
So I'm covering this because African-American women have a much higher incidence of fibroids, and we think it might be linked to the vitamin D levels, which are lower in African-Americans.
If you want to look at the numbers, it really is significant. By the time a woman reaches the age of 50, up to 50% of women have fibroids. In African-American women, 80%. 80% by the age of 50. So that is a significant difference. So if there's something that you can do as simple as dietary modification, I think it's definitely worth it.
So you're all clear on this. You're going to cut down to some of those simple carbohydrates, which you ought to do anyway.
Yes.
A little bit less of the fatty food and get your vitamin D, and at least you can reduce the chance of that fibroid either being there or growing large enough to cause you symptoms.
Yes.
Thank you for being here. I hope that was helpful. And I want to talk to each of you afterwards, because I do think that there's a lot of fear around fibroids. Part of the reason I went through the show today is to show everybody there are things you can do that are either non-invasive at all with food or minimally invasive, so you can actually do things you want to do in your life without losing your uterus. We'll be right back.